confirmed cases of Ebola popping up first in Texas, then in New York, and dozens of scares across the nation, we spent weeks on high alert. The alarm here at home seems to be dissipating, but thousands of nurses across 9 states are protesting this week, in part over concerns about Ebola safeguards. Here in Massachusetts, some of the nation's best hospitals are not taking any chances with the highly contagious virus. From cameras that monitor vital signs to remote-controlled pumps that administer medications, the infectious disease team at Massachusetts General Hospital is on the cutting edge of Ebola treatments. But until these robotic innovations are ready to assist with patient care, MGH is sticking to the basics, regularly training staff on the best techniques for dealing with any dangerous and highly communicable disease, and reinforcing the proper way to handle equipment, don and remove protective gear, keeping careful records every step of the way. My next guests are leading MGH's Ebola efforts. Dr. Paul Biddinger is Medical Director of Emergency Preparedness, and Dr. Julian Goldman is Director of the Medical Device Plug and Play Program. Welcome to both of you.
Thank you so much.
So now, did MGH volunteer for this? Or
well, we didn't volunteer for this, but we think it's really our responsibility to the community. As one of the big tertiary care hospitals in the state, we know that we have to be ready to care for someone if they come from overseas with Ebola, and we want to do so safely without putting our staff, our patients, our visitors at risk. And it's taken an awful lot of work to do it, but we feel confident in what we're developing. So
this really goes well beyond Ebola, though. I mean, this is kind of the hook into it, but you could treat any number of infectious diseases, even the flu, I mean, if it came to that in an environment like this.
Well, there's no question about it. We all recognize that sometimes there are the urgent, immediate needs that galvanize a response, but we're always looking over the horizon for what's next. This is just a way to move more quickly. And we're able to do this now because during prior episodes and other urgent conditions, we were already thinking about the possibility that something like this would show up.
So is this space it's kind of set aside and is only used for training right now, or is it actively in use?
Well, so it's a couple of different programs, really. Right now, we have a special space for training, and we have to use what we have, which is equipment and very dedicated personnel, train them, get them to use what they need to do very well to take care of patients. But it's still a high-risk endeavor, and so we're always looking to see what can we do to help us deliver care better, more safely, and that's where innovative programs like Dr. Goldman's are so helpful.
I know you don't like it when people fixate on the gizmos, but I mean,
gizmos are okay.
You know, like you've got these little robots that will be able to deliver some services. Right now, they're not really up to that.
They're pretty close. You know, what happened in this just a few weeks ago, when we realized just how urgent the response may have to be, we started to say, how could we look at the medical devices and other technology, and how could we perhaps use it a little bit differently? So in this case, we brought together a group of manufacturers, the FDA and other federal agencies, and we said, if we were to look at the medical devices that we currently use, what could we do differently to enable our patients to be safer and our caregivers to be safer? So in this case, we thought, well, why should someone have to go into an intensive care unit or isolation room to adjust medical devices? Gear up in maybe 10, 15, 20 minutes of time to do it properly. Instead of doing that, why not just use a remote control capability and adjust medication infusions and so on? So how can we use technology in a smarter and better way? But these products aren't on the market.
Right.
So we had to say, well, what's a safe environment that isn't a clinical environment? In other words, our lab, which is a biomedical engineering lab, so that we could prototype these ideas in a community with manufacturers and everyone else at the table.
So one of the big issues when the Ebola scare first broke here was nurses, and they're concerned that there wasn't proper training, there wasn't uniform training, that some people were being handed, you know, plastic gloves and a blue pullover, but you have some very specific training that goes far of, you know, donning and duffing these outfits that are really, well, here's a little bit of it here, that they look like spacesuits, really.
Well, I think, you know, unfortunately, we know that Ebola is different than almost anything else we take care of in the U.S. healthcare setting. The infectivity, the fluid, the amount of fluid that's created, and you need that level of protection, and you have to take it very, very seriously for how well you both put it on, but most importantly, take it off.
Take it off.
Exactly. And this just isn't something we do otherwise in healthcare. So we've at Mass General, we've selected a small team of people in the emergency department and our intensive care units to train exceptionally well. Exactly.
Wow.
And you can see in this video that it takes him almost 10 minutes to very carefully, very methodically take off that gear.
But she's touching it.
Well, so this is a training session, so she actually would have been in the personal protective gear. We're missing the video there, or the audio, excuse me, with the video. But you know, I think it's two things. One is we take our responsibility to provide the right equipment, to provide really, really good training and repeat training very seriously. But if we can get away with not having to use humans at all for certain tasks, better to get great technology. And you know, Ebola is an interesting example. It's been around for 40 years, but we've never seen it like this in West Africa. We've never seen it like this in the United States. There will, unfortunately, I think, always be emerging challenges for which we have to adapt rapidly. And the challenge for both of us is to be able to adapt rapidly, develop new solutions as quickly as we can.
And of course, the tragedy when you look at what's going on in West Africa is they don't have anything like this.
Right, right. Well, exactly. So we received a number of questions last week during the several days of these technology demonstrations and kind of a hackathon. And some people asked, very reasonably, are you working on technology that can be used in West Africa, or is this really for, say, the US? And sometimes you have to start with more complex environments, and then you could refine the approach and decide which pieces of this would be most useful to use in a more austere environment. So we really, you know, this is just the beginning. We didn't solve everything last week. We just got started on the journey.
Good start. All right. Paul Biddinger, thank you so much. And Julian Goldman, thank you.
Thank you. Good to be here.